Good morning. My name is Jim Cantwell. I'm the state representative for Marshfield and Scituate, which we affectionately call the Irish Riviera. It's my pleasure to be here today as a lead sponsor of our budget amendment to bring integrity of emergency ambulance services. I'm also proud to be joined by so many of our fire chiefs, so many state and local officials. Just my colleague Carolyn Dykema is here, Paul Broder is here, Rhonda Nyman is here. We have over 20 sponsors for our legislation that is the source of this amendment, and I want to just give reasons for why I'm here in strong support for this amendment. This is my third budget debate here at the State House. We've been forced to cut almost each of the last 2 years cutting local aid. Indeed, we're looking at a $2 billion deficit just in this budget right now. Most of this is for issues that are beyond our local control. This is an item that we do have control over, however. Indeed, we need to not be adding to our local taxpayers' burden if we can avoid it. And one of the statements that you'll be reading, or that we have read, is Blue Cross Blue Shield says that allowing them to reimburse patients directly is going to be a savings of $80 million to them. And indeed, they're correct. That is $80 million of savings to them. But it's a cost shift. It's something that's going to be borne by our local taxpayers. What's really going on is that they're trying to force ambulance companies and our local governments to join their provider network. It's why they're telling people either join our network or we're going to pay the patient directly. There are three things that this amendment does. The first is to prevent the ability for the insurer to pay the patient directly. Why is that important? All of these professionals behind me can tell you that we have frequent flyers, people who like the excitement of having an ambulance service run. They call often. If they learn that they can get a check for $1,000 each time that they decide to say that they're having some chest pains, these folks have to provide the service. They're going to get the $1,000, and indeed our city, our town, or our ambulance provider is going to have to sue them and chase them. The second part of our amendment, there is a genuine interest by all parties involved to try to keep healthcare costs down. We get it. It means that we can try to have costs kept at a minimum. We've tried everything from pegging a rate to be 3 times the rate of Medicare. We strongly believe that we could use a rate that would say the usual and customary rate as charged by the industry, charged by the ambulance provider. This amendment does what we think is best. This amendment says that the rate is going to be the lower of either the usual and customary rate that's charged by the provider, the ambulance provider, or it's going to be determined by our local professionals, by our fire chiefs going before their board of selectmen or to the mayor and determining this is what a fair cost would be to our own citizens. It's our strong belief that we won't have our own mayors, we won't have our own fire chiefs charging a cut rate or indeed charging a profit to our citizens. We've seen that this has been done efficiently and appropriately. The final part, which is very important, is having no balanced billing. The governor sent back language last year that I firmly believe is appropriate, that we want to protect consumers. So after we have this rate that's set, if the insurer decides that they only wanted to pay a certain rate, they were trying to, again, undercut what was a usual and customary practice. We didn't want consumers to have to be paying that difference. Again, it was an example where Blue Cross first was trying to push the cost to our local communities and then said, well, maybe we'll push it off to the consumer. No. Our amendment is making sure you'll have no direct payment to patients and you won't have any balanced billing.